Aneeta, chat. Go, okay. Fine.
So I put a recording on the cloud. So whoever is the host of this meeting will get access to the recording.
Right, right.
Thank you, Dr. Madhok. Please go ahead because Remy just said that he had some technical issue on his end. So please go ahead and continue with your presentation.
Well, I completed my presentation. You can have Dr. Khor to speak now.
Oh, perfect. SK, would you be able to put up your one slide to speak?
Sure, let me try. I think it should work. Give me a second.
Remy is going to sign back in and see if he can get in. Oh, okay, so we got your one slide, perfect.
Great, so do I proceed? Aneeta, do I proceed?
Yeah, please
Yes,
go ahead.
please. Yes, please.
Great, let me continue. Just checking that you can see my screen. Let's start there.
Yes, we can see your screen, perfect.
Great, thanks everyone. It's a pleasure to be here, and I will like to share a few thoughts about how health and wellness for global productivity can be seen through a health systems lens. So my first slide of 2 slides only, this is the first of 2 slides, that is my disclosure and introduction slide. I'll pause here for a few seconds just so I can disclose that I have no conflicts of interest and your opinions are solely my own. This slide describes my current career, my 2 previous careers as well, and the places in which I was educated. I'll be pausing here for about 30 seconds. Thank you, everyone. The short story for me is 5 years as a medical doctor, 6 years with refugees, 8 years with pharma, 4 years in global health, 1.5 years in digital health. And I've got 3 masters in medicine, in public health, and in public policy. With that disclosure and introduction out of the way, let me go on to the one slide. In this one slide, I have 3 things I'd like to share with everyone in terms of how health economics, and health systems can be related to global productivity. So we'll start on the left-hand side of the screen. On the left-hand side of the screen, we'll see that the point is that health is more than just healthcare. What is the difference between health and healthcare? Is a very valid question, and the difference is very large. So we start by saying, what is healthcare? Healthcare is small. An example of healthcare is a doctor delivering a surgery in a hospital. Another example of healthcare is a nurse delivering a vaccination in a clinic. That is healthcare. But when we talk about health, it is much bigger than healthcare. For example, health can be the conditions in which somebody is born, a baby is born, the housing conditions or the living conditions of a particular country, especially for the poor, labor rights, employment rights, which when you come to think about it, it's actually very complicated because maternity policies, sick days, menstrual leave, mental health days, workplace insurance, workplace safety, workplace wellness, a non-abusive, non-threatening, non-bullying workplace, all those rights of a human being and the rights of a worker are considered health rights, and they're under labor rights. Therefore, the Ministry of Labor, and these rights are not under the Ministry of Health. So therefore, that's one example of how health can be considered to be bigger than healthcare. Another example of health is being so much bigger than healthcare is in education. We talk a lot about literacy, meaning during the COVID period, when the world struggled to vaccinate people because there was so much misinformation and disinformation about the COVID vaccine. And education, health literacy, providing ways for people to break out of poverty, all those things are considerations of health, not healthcare. To be clear, healthcare is hospitals and clinics, doctors and nurses, surgeries and medicines. But housing, labor, education, gender, maternity, social care, nutrition, clean water, all these things are considered health, but they are outside the purview of a traditional health ministry. Therefore, when we look at global productivity, we must understand that health is a lot bigger than healthcare. Now, all those things I've mentioned is has a term. The umbrella term is called the social determinants of health. The scientific determinants of health are things like biology, chemistry, biochemistry, pathology, physiology, all of which I studied a long time ago, 20, 25 years ago. And then I moved on gradually away from the sciences towards the social sciences, studying public policy, law, economics, the legal determinants of health, because we understood in health among the scientists that the scientific determinants of health alone are not enough. We must also look at the social determinants of health. And therefore, the social determinants of health are political. Why? Because the conditions of birth, housing, labor, education, and so on that I've listed in the second bullet point over here, none of it is scientific, all of it is political. Therefore, if you want to have good productivity and you want to increase the productivity of a company, then we have to make good political choices. The second thing I'll say about health and wellness and global productivity is to talk about economics, because there's no way that you can talk about global productivity without talking about economics. So the second component over here in orange in the center of your screen, it's about health economics and how fundamental it is. So I begin with a fundamental and philosophical question of how do you measure health burdens? You can measure in two ways. The first way is clinical. You can measure health burden, like diabetes affects 20% of people in Malaysia, hypertension affects 40% of people in Malaysia, and so on. That's one way to measure disease burden. The second way to measure disease burden is something called a disability adjusted life year. Now, people spend entire PhDs just studying about DALY, disability adjusted life year, or QALY, quality adjusted life year, or YLL, years of life lost. And these are clinical measures of the impact of a particular disease, like dementia causes X number of disability adjusted life years lost in a particular country in a given year. Diabetes costs Y number of dollars, for example, that is spent. And that's where I go to economic criteria, actually, to measure the burden of a disease. And when you look at economic criteria, you will look at dollar spent, purchasing efficiency, healthcare spending as a percentage of GDP. All these things are measures of how you estimate a disease burden. However, for productivity reasons, I like to introduce two terms to everyone. The first term is presenteeism, and the second term is absenteeism, meaning how many people, how many employees of a company are present, they come to work, even though they are sick, but they're not able to operate at the fullest potential. Why? Because they are sick. They have a headache, they have pains, they have chronic fatigue, or any other problem. Why do they come to work, if you might ask, if they are sick? And the answer is they may have run out of sick days. They may not have health insurance. If they don't come to work, then they don't get paid for the day, because half the world, 90% of the world, are on day wages and not on salaries. So that's presenteeism. You're at work, you're sick, you're at work, but you're not able to contribute to your fullest percentage. And people can put a number to that, and the percentage or the dollar value lost to presenteeism every year, I don't know what the number is, right? So these numbers are going to be estimates, but I estimate that number will be in the trillions of US dollars every year for presenteeism. What is absenteeism is when somebody does not show up for work because this person is sick, genuinely sick, by the way, not the cheating type or the malingering type. And presenteeism and absenteeism has a dollar value attached to it. Therefore, even health economics is able to calculate the impact of health or ill health or sickness on global productivity. Finally, let me move on to talk about health systems. I think the previous speaker, Dr. Aneeta, has mentioned very, very well about how good health is good business. She may not have used these words, but she drew the straight line between good health to productivity and good health to good business. So let me make it more stark. Good health is good business, the same way good ethics is good business as well, because healthier employees have fewer sick days, and if you have a good health plan for a company, you can attract top talent. So that's a given. I don't want to make obvious statements, especially building on the excellent speech by Dr. Aneeta earlier. So instead, I'll end with a thought. The thought is that healthcare can often, and health itself, can often be considered a cost center by companies. Now, many of us, right, I'm preaching to a choir, really. All of you understand that good health equals to good productivity because you are part of the World Academy of Productivity Sciences. The point I'm making over here is that we, all of us, will need to go out and tell companies that good health is not a cost center. Good health is actually an investment in your human capital, an investment in your colleagues, your employees, the people that you work with, so that they can come to work healthy in body, mind, and spirit, and therefore able to bring their best selves So therefore, my final parting thought is that companies that consider health as an investment in their bottom line and not really a cost center. I want to say thank you again to Aneeta Tan for inviting me to share my thoughts with you briefly. I'm happy to end at about 9 minutes and return the rest of the time and the floor back to Aneeta. Aneeta, thank you very much.
Thank you, SK. In fact, my question is, do you think that we can educate the companies, well, the board basically, and the government to look at all these things you've just said about productivity, whether they're absentees or they're halfway being able to be productive or not?
Great question, Aneeta. Thank you. Your question is, can we educate companies? And the government answers yes. We can always do a bunch of education, seminars, workshops, events to companies and to the government. So I'm absolutely in favor of education. I think though that education is necessary but insufficient. We need to say we have to do education and do that constantly, but I think we need a basket of other solutions as well. The objective is that companies will prioritize their employees' health, therefore increase productivity. That's what we want, right? So education is one component. I think we also need incentives, tax incentives, and finally, I think we need the stick, meaning we need laws, regulations. The government needs to come in and punish. I'll use that word. Punish, fine, and disincentivize companies if they don't prioritize health and wellness for their employees. So educate for sure, and then provide a carrot, and then provide a stick. In terms of a carrot, it could be tax incentives, tax breaks, and so on. And another carrot would be social prestige. I think large companies these days are very interested in portraying themselves as ESG compliant, SDG compliant, DEI compliant. I mean, environmental, social, and governance factors, sustainable development goals of the United Nations, and thirdly, diversity, empowerment and inclusion. Thank you. DEI, I'm sorry for that. So these three acronyms or three letters which are actually very powerful concepts. So the accreditation process for companies could be helpful. There needs to be like an ISO, the International Standards Organization, but for healthcare, meaning companies that meet a certain standard for healthcare get a gold star. And companies that don't meet that standard gets a silver star and a bronze star or no star, for example. And we should encourage as many large cap and multinational companies to come and accredit themselves and then perhaps gradually move on to the small and medium industries and enterprises around the world as well. Noting that SMEs employ a lot more people than the large caps and the listed companies. So that's on the carrot side. And on the stick side, I think no company will really move unless there's an appropriate set of laws and regulations with fair and predictable enforcement. I mean, we don't need strong enforcement like the death penalty, for example. If you don't have an employee wellness program, I think that's overkill. The point I'm making is that even small enforcement actions that is fair and predictable will be a lot better than instituting a nuclear option. Look, I'm not suggesting that we have the death penalty. The point I'm illustrating is that small but fair and predictable enforcement actions are a lot easier to persuade and change behaviors than very erratic, unpredictable, but very violent punishments. Aneeta, thank you for your question. I'm happy to share thoughts to say that education is important, but also the carrot and the stick.
Understood. Thank you very much. I wonder if Remy is back because he has a technical issue and then he's trying to get on again, but I don't seem to see him, which will pose another issue now because the presentation from Dr. Harung, it's on Remy's side. So Dr. Harung, if you can unmute and if you'll be able to give us some background first until your presentation is on.
Yes, thank you, Aneeta. Can you hear me?
Yes, we
Yes,
can
we
hear
can
you.
hear you.
Hello, I'm speaking from Norway, and my field of interest is peak performance or world-class performance. So I'm looking at productivity from a broader perspective than most people, because high performance, of course, includes high productivity, but it's also high quality and high satisfaction. So this is my field. I have, together with my colleague, Dr. Fred Travis, in the USA, we have studied the brains of people performing at the very top in the world. And as I will show in my presentation, the brain is quite different from normal average performers. So I think that what has to gain a lot of importance in the world is how you can develop a world-class brain. I think that any person who is born with a normal brain has the potential to develop his brain to a very high level of performance. The situation today is that at school, the school up to the age of 17 to 20, a student or a child develops his brain, but his brain development is much less than it could have been. And then from the age of 17 to 20, for almost everybody, brain development stops. So in my world, this is one of the major problems in the world because with higher mind-brain development follows better health, which is the context we are talking about here today, but also it follows that people with higher development of brain and the corresponding development of the mind, they have much higher levels of empathy, they have much higher level of morale, and they have much higher level of creativity and intelligence. So all these factors are important in contributing to increased productivity. Have you got my slides now?
I do not think so, because Remy is
Okay.
not one. Is it possible? Well, I think what we can do is, if you don't mind, just go ahead and do the presentation. And when we're sending out the email follow through with the video, we'll be able to send out your presentation if you don't mind.
Okay, that's okay. We'll go ahead and I'll try to keep it as simple. So what I want to present to you is practical methods to improve your health and improve your brain integration and refine or improve also your mental abilities. Because these are all related very closely together. So I actually will be talking about practical procedures that have their origin in India, even though I come from Norway. So I will be talking about Ayurveda, which is the oldest system of health in the world, coming from India. It means the science or the knowledge of life, and it is a knowledge which has been revitalized today in recent time by a person called Maharishi Mahesh Yogi from India. And this system of health has been improved by the World Health Organization. And in the USA, there is no master's program that allows people to specialize as doctors and nurses in this Ayurveda approach. So it's getting a lot of acceptance in the world. And the main focus of Ayurveda is a long-term prevention. And it is therefore complementary to traditional medicine, Western medicine or modern medicine, because in the modern approach, then the focus is on a short-time cure. So long-term prevention and short-term cure are very complementary to each other. And this is actually called integrative medicine. And it is also an individualized approach, which is a bit contrary to modern medicine, because that tends to do all people more or less the same medicine for everybody if you have a disease, for instance. But in Ayurveda, your medicine is individualized. So that is, I think, a very important feature. And the most important, there is a lot of research on Ayurveda. And for instance, there is something called Panchakarma, which is the oil massage of the whole body. And in just 3 months of oil massage, this Panchakarma, together with getting certain herbs or herbal medicine that are suited to your conditions and your disease, there is about 50% improvement in many health problems, like well-being, energy, strength, stamina, sleep, mental clarity, and youthfulness. So all this, of course, is very important for productivity. I think that's obvious. And so 50% improvement. And the most important aspect of the Ayurveda, the modern approach to Ayurveda, is a technique called transcendental meditation, or short TM, which is taught in 120 countries around the world, and which is a very simple technique. You meditate only about 20 minutes morning and afternoon. And there are many companies around the world, and there are also about 1,000 schools around the world where this technique is practiced as part of the daily routine. And there we find research showing that people who have been meditating for about 20 years, research from a health insurance company in the USA show that they have much less illness, about 60 to 70% less illness and hospital days and outpatient days than the non-meditating controls. So just this technique is very effective. Of course, there are many meditations offered today, and a comparative study at Stanford University in the USA found that this TM technique is about twice as effective as other meditations in reducing anxiety. And I think we have to agree that anxiety or stress is a very severe challenge for productivity, for increasing productivity. So this is research from a very simple technique that only takes about 20 minutes morning and evening, and we can do anywhere in your office or in the train or at home or in the airplane or whatever. It's very simple. Okay, so that was, do you have any questions so far before I go on?
I don't have any question. Anybody have any question? Sunil, do you have any?
Not at this stage. I think we can have the discussions once he finishes.
All right, very good. So what I want to move on to now is to talk briefly about our studies on world-class performers. We looked, this research was going on in Norway and a little bit in Sweden. And we looked at top-level managers. These had been managers for 18 years on average and were acknowledged as being good, solid managers. And we compared those two managers at, these were CEOs, and we compared them to managers at the lowest level, like a project manager or department manager. Then we looked at world-class athletes. They had won on average 10 medals in world championships and Olympic Games. So they were really very high performers. And then we looked at professional classical musicians. The athletes we compared to average performers in sports. And then we looked at world-class musicians, classical professional musicians, and compared to amateur classical musicians. And we found the same pattern. We developed a measure of mind-brain development, and the world-class performers scored almost twice as high as the average performers. So there was a huge difference. It was very highly significant statistically. And the way we looked, what we looked at were three things. We looked at how integrated the brain is, and that is how coherent, how well the different parts of the brain are collaborating. It's like in an organization. If people are communicating and collaborating well, then the organization will perform on a high level. And the same applies to the brain. If the different parts of the brain that have different responsibilities communicate and collaborate in a good way, then the brain is very efficient. And we also looked at alpha-1 brain waves, which are known to be associated with being awake and alert and relaxed at the same time. So it was like a restful alertness. And then we looked at how economical or efficient the whole brain works. The other measure we applied was moral reasoning, how moral the behavior of these people were. And the third thing we looked at is what is called peak experiences, which are the moments, most happy and fulfilling moments in life. It was a term introduced originally by Abraham Maslow. And this is a taste or a glimpse of higher consciousness. The thing is that we as humans today are actually on the average in the world on the rather early stage of development. There are tremendous range of development in man that only the world-class performers have strong glimpses of. So when we combine these three measures, we found that, as I said, the world-class performers scored almost twice as high as the controls, the average performers. So this seems to be a very reliable measure of your performance capacity in several different diverse fields of activity. And now going back to transcendental meditation again, we have studied people who have been meditating for many years. And it's interesting when we compare them to the average performers and peak performers in our study, because we found that people who had been meditating transcendental meditation for 24 years, they scored almost twice as high as the world-class performers on brain integration. So my conclusion therefore is that we know a lot about the features of people performing at a very high level, which of course will involve also being very productive. And we know quite a lot about the brain of these people, these high performers, and we now have practical methods to develop these features, and these practical measures we find in the ancient revitalization of the ancient Ayurveda tradition of India, and in particular, this simple mental technique called transcendental meditation. So I have, my perspective is that we really have now the key to develop substantially higher productivity and performance in general in the world. And I will also like to add that there is 20 research projects that show that when only a small group of people practice the transcendental meditation in a society, then crime and war declines very much in the surrounding society. So we do now have practical methods to really develop the whole society in a direction that will also substantially improve productivity, which is the topic of this seminar. So that was my contribution. I'll, of course, be very happy to address any questions you may have.
Now I'm back. I'm sorry, technically, I don't know what happened, but my system had, reboot. But thank you very much, Dr. Harald. Thank you, everybody, for, holding forth. Try back. Thank you, Aneeta. So I have a few questions. So I want to start. As Dr. SK, have you done your presentation?
Yes, I have.
Oh, sorry, I missed that. I was battling back here with technical, issue, but then I'm good. So I'm going to ask my question right now, and then other participants can ask questions before we give it a wrap. I'm sorry about how today as it's going. Okay, so Dr. Aneeta, I wanted to ask you, as an HR, someone with an HR background, and then also with psychology and coaching, right? What do you think is the role of organization in maintaining or in finding help for workforce to be more healthy? Because organizations want to make their profit, they want to make money, they want to result, they push you to get results. And then people might be falling down, people might be having health issues. What is the role of organization? What is the role of organization?
Well, we did, you dropped out of the presentation, but on stage I did say that there is almost 27% more productivity happens when organizations invest in work-life balance. So if I want to, if I'm looking at my bottom lines, I'm looking at my profitability, I'm looking at, how to maximize my returns, I need to also invest in creating work-life balance for my employees. So, the culture of the organization, if it is one of exploiting the workers and exploiting the employees, it is counterproductive. Because the workers' productivity falls if they are not able to find that balance. So the only way is for them to create proper working conditions, proper work environment, proper work culture, so that employees remain engaged and they also go home on time and spend time with their families, etc. So that is one level of input that organizations need to do, is to build a culture which is more harmonious to their well-being, rather than, and it's a business case also, because you get 27% more productivity if you invest in creating that work-life balance. The other thing that organizations also need to do is to have concerted efforts and well-being programs in the companies. Till before the COVID scenario, we used to find many organizations used to have one-off program on well-being, one-off program on managing heart disease or managing diabetes or managing stress. It used to be one sporadic program here and there. But now most of the organizations in India we find, and I'm on the jury of one awards for well-being, which is going to happen in the next month. And we have received over 100 applications from companies that are presenting their well-being programs, how they have a proper concerted effort, an organized effort at investing in well-being. Sometimes it's simple, a doctor on call or a psychologist on call, a suicide helpline, or, and sometimes it is more of, education-based, so making people aware. I myself go to many companies, and tomorrow I'm speaking at one organization on integrative health and how do you manage your stress at the workplace. So there's a lot of education and training around this. There is also specific welfare facilities set up where medical services are provided. There's medical health insurance taken out for many people. So there's a proper program in place to manage physical and mental health, as well as create a culture which is more vibrant and more people engage in the mind, body, heart, and soul.
Thank you.
So, yeah,
Thank you very
lots
much.
that can be done.
All right. Thank you very much. Yeah, I know we've spent so much time because of my in and out, but I'll still ask Dr. SK. Dr. SK, looking at your profile in line with medicine in Malaysia, the physician, specialists in health system and all that, where is a place of medicine and wellness? Some people say if you take medicine, it also have side effects. Some say rather don't take medicine, rather do something to be well before you get sick to now take medicine. So what is the balance between medicine and wellness for individual? Yeah.
Remy, this is a great question. I don't know how to answer this question completely. And also try to relate that to the topic of tonight or today, which is about global productivity. Here's my attempt at an answer anyway. Firstly, medicines are very helpful, but cannot be a substitute for a healthy lifestyle of good nutrition, good exercise, good sleep, proper mental adaptations to mental stress, coping mechanisms like meditation, and so on. So all those things are important for sure. So medicines cannot be a substitute for those things. Neither can those things be a substitute for medicine when medicine is necessary. For example, no amount of exercise will help us cure a cancer if one person already has a cancer. Therefore, this person requires surgery, maybe even a monoclonal antibody, targeted chemotherapy, for example, in order to cure this person from cancer. All of which should say is that the multiple modalities that have been discussed tonight, all of them are important, and all of them are important at different times for different people, for different reasons, and to be prescribed by different people as well. All of this is to say that we cannot say that medicine is good or bad alone by itself, black and white, binary statement. Neither can we say that everything else is good or bad, binary statement, black and white as well. So I think there's a lot of nuance, a lot of complexity in the world, and that's the first part of my answer. Let me give the second part, then I'll pause and return the floor back to you, Remy. The concept about the medicalization of healthcare is very real. Now, again, I'm a medical doctor, I'm trained in medicine, I'm a scientist, and I believe in science. However, I also believe at the same time that healthcare has been over-medicalized. None of this is to say that don't take medicines when we need to, okay? However, if we can't also take medicines for everything. An example of over-medicalization could be in the field of mental health, where we treat mental health, anxiety, depression, just some general mental health disorders with a medicine, and doctors reach for a medicine, a pill, a drug too readily, for example, in mental health, when we should be treating the other conditions like how your social networks, do you have friends that you can rely on, that you've got a good social and emotional support network? Are you paid a living wage? Because no anti-anxiety medicine will be good enough if the person is not paid a living wage, forcing the person to live in a constant state of anxiety. All of which is to say that I think medicine is helpful, but we cannot over-medicalize healthcare. That's my short answer to this, Remy. Remy, back to you.
Yeah, thank you. Thank you. I mean, I agree with you. You get to your point that you need to take medicine, but I want to go to the angle of Dr. Harald now, which is the angle of the mind-brain, you call it the mind-brain development. I think going to yoga, having the meditation, and all those, spiritual regurgitation is what Dr. Harald is trying to push. So Dr. Harald, are you there? Can you hear me?
Hi.
Okay.
Yes.
I want to ask my question now, taking it from Dr. SK. Now, what does meditation really mean? How can you self-heal yourself through? Is there a process that somebody who doesn't know anything about meditation? Who doesn't know anything about mind-brain? Is there a process for somebody who is just, coming in for an event today? What are the things that I need to do to be able to self-heal myself, just like Dr. Aneeta was saying the other time? I mean, in line with your own perspective and expertise.
Yes, let me first of all say that I agree to the last speaker very much, that approach to health has to be integrative. It has to involve, for instance, getting enough sleep. That's a very important factor. Exercise, and also music. We found that music actually integrates the brain. That's a good thing, and having a social network, having friends, and a good nutrition, all these factors combined. And TM is one approach. It's a mental approach, and I also was talking about Ayurveda. This is a more physical approach with herbs and oil massage and daily routines and things like that. And it all works in synergy. And if anybody wants to learn or investigate the transcendental meditation technique, TM technique, so they should go to a website called tm.org. tm.org. It operates in 120 countries around the world, so I think most people will be successful. And to learn the technique, you go through a very simple course. It's about 7 steps where you learn the technique, and then you're giving knowledge of how to practice it. As I said, it's a very, very simple technique. It's you can learn it as early as 3 years old. And there is no upper limit. And this is very important because there are many meditation techniques on the market, but I think many of them are more difficult, more intellectual. This TM technique is very simple. And talking about people with social problems, there have been several research projects showing it's effective against PTSD and ADHD, for instance, and people, criminals, and anybody can learn this technique. So there has been research showing that recidivism in prisoners, when they learn TM, is reduced dramatically. So it is a technique for everybody, and it's very, very simple. Yes.
We are going to go ahead to check that after leaving here to check the website. Thank you very much. Thank you. All right. I want to open the floor for in a few minutes for anyone who have contribution or question so that we can wrap up. And any contribution will be 1 minute. 1 minute contribution, right? Just 1 minute. All right. Thank you. Go ahead. Go ahead, sir.
Right.
Go ahead. Yes. Go ahead. Question or
my name is.
Question.
No, I would like to raise 2 questions.
Okay, go ahead.
And maybe 1 comment. First of all, it was a very interesting presentation, listening to 2 medical doctors and also our own Aneeta Madhok, whom I used to know as an HR professional. Now, today, I also know that she is also involved in interactive healthcare management. It's a very interesting presentation. I have, as I said, two small questions. Maybe Aneeta Madhok or someone else can address. And 1 observation. Normally, whenever we discuss, because I am a technical person and then turned into management. So my question possibly will be related to basic productivity, the way we understand. Whenever we discuss productivity, we understand it is whether it's a business organizations or nations or countries' productivity. We understand it as a total factor productivity, which combines 3 factors. One is the labor productivity, machine productivity, and capital productivity, or 3M, man, machine, and money. Now we are discussing in today's context the only labor productivity or human elements of the productivity. Now, in terms of labor, we have three types of labor inputs in the organization or in the business or in the industry, whatever you would like to call it. We call blue collar labor, then white collar laborers like us, and then red collar laborers, which are government employees. You see, as per our understanding, the contribution of these three categories are different in terms of, even if we only focus on labor productivity or human productivity in the organization or in country or in business. Now, in the context, now we are discussing, and this is a serious discussions. We are regularly attending conferences, discussing and writing papers on that.
1 more minute.
Okay, 1 minute.
Yeah.
1 minute. I will not extend more than maybe half minute. The emergence of artificial intelligence, machine learning, and robotics, and all kinds of things, industry 4.0 related technologies, you see, which are likely to replace human beings. This is largely replace the middle level and the lower level. In that context, what will be the input of the health in terms of health or nutrition, in terms of improving the overall productivity of a business? That's my one question. The second question, particularly to Aneeta Madhok, she mentioned interestingly two things. She said that primary food and secondary food. I would like to know if there is any study, what is the contribution of primary food and the secondary food in terms of the human, the health. You see, these are the two questions. So, and later on, if the time permits, then I will give some observations or comments. Thank you.
Anita, I want Dr. Anita.
Only one comment that I would like to make. It was interesting hearing Harun from Norway talking about transcendental meditation. The transcendental meditation, but that also an Ayurveda from a person from Norway. But it is very interesting for us because we are from India. Now, I would like to mention that in 1980s or 1990s, Mohesh Yogi introduced transcendental meditation in India. Wow. And we all have undergone that program of 20 minutes every day in our businesses. So possibly we have some other observations about it.
Maybe another time I'm going to do full meditation and productivity in another session, but not today. Not today. All right. So, thank you very much, sir. Thank you, sir. Dr. Aneeta, 1 minute to take the second question, and then Dr. SK, look at the first question: AI, the place of AI and health in this our new world now. And Dr. Aneeta, talking about the two levels we talked about. Can you just speak 1 more minute, please? I'm checking my time so we can wrap.
You spoke about primary food, and primary food being your relationships with family, your social circle, the amount of exercise that you do, physical movement, the spiritual practice that you have, a connection with a larger purpose in life. Do you have a job or a career that you find fulfilling? These are all what we call primary foods. And there are many researchers, many researchers. I can cite the research of Dan Buettner, who has written a wonderful book called The Blue Zones. And he has identified, areas in the globe, all over the globe. He was a National Geographic scholar and a fellow of the National Geographic Society. He identified many zones in the world where people have healthy and very long lives. They typically live beyond 100, average age is very high. The life expectancy is extremely high. And then he looked at what are the causes and the reasons for these. It was a longitudinal study spread over several 30, 40 years. And he found that it was primarily social activities. These were not people who had and it was also a healthy diet, of course. But the primary reason was the social life of the person. As grandparents, how they are respected and not neglected. As social, they hang out with their friends. every evening after dinner. So he found a lot of social linkages with which was linked to longevity in the
Awesome.
research that he did.
Thank
So
you.
I hope, Dr. Baisya, this answers your question. This was one research, but there are many.
Don't worry.
many.
You're gonna write. You're gonna write. A
What is the relationship between longevity and productivity? A man can
we
live
cannot
100
take-
years,
we can't
but he
take
may
all
be
the best.
productive for only 30 years.
Oh, no, but all these people who are beyond 100 also continue their work. They are shepherds in the farm and they take their sheep out onto the mountains.
Yeah.
They continue active,
Yeah.
active life.
People, they
through.
can give ideas, they can give advices, they can give their intellect. In as much as they are still alive, their brain is still working. Thank you very much. Thank you, Dr. Aneeta. All right, Dr. SK. AI, the new reality and health. How do you just oppose that? In 1 minute, please.
Remy, thank you. Again, the connection between artificial intelligence and productivity and health is not immediately clear to me. However, what I might say is that AI can increase the productivity of healthcare workers as opposed to the productivity of the whole world or in different non-healthcare industries.
Yeah.
There are different ways in which AI can increase the productivity of healthcare workers. A few quick examples. The first one being, doctors will find it easier to diagnose a condition and or to validate their initial diagnosis. This is one. Number two, it is possible to use artificial intelligence on large data sets in order to look for what we call precision public health, or to look for insights within large data sets that can tell us, is a pandemic coming? Is a pandemic evolving one way or the other? Or how should we allocate our resources from diabetes or hypertension or heart disease or cancers, for example? That's the second way in which artificial intelligence can help in healthcare, increasing the productivity. And the third and final example is to use artificial intelligence to look at still images. So AI is good at looking at three things. The first one is text, number two, images, still images, and number three, moving images or videos in this case. AI is not so good at videos at the moment, but AI is very good at text and very good at images. And there's already a very substantive use of artificial intelligence to look at how CT scans, MRI scans, PET scans, and X-rays can actually be read, not by a human being, but by an artificial intelligence machine or a software or a tool. With that in mind, Remy, those are my short answers to your question of how AI can increase the productivity of healthcare workers. Back to you, Remy. Thank you.
Thank you very much,
One
Dr. SK.
sentence, yesterday on BBC, there was research that was revealed that said that usage of Facebook, we all have Facebook posts, and usage of Facebook has no correlation with ill health. There's the people suspect that, because you do too much Facebooking, you might be having bad health, but they found no evidence in the study that there was no correlation between your social media usage and your health issues. I just thought it was an interesting trivia for you.
Can I add a thought? Can I add a thought?
Okay, one second, sir. 1 second. Okay, 30 seconds. Go ahead, sir.
It's just, I think that artificial intelligence will mean that we will be working less and less, and therefore have more and more time to enjoy life and be with friends, be social, exercise, meditate, listen to music. I think I think the world is changing for the very much better, and I think artificial intelligence will be one of the important ingredients in improving our quality of life.
Thank you. Awesome. All right. Thank you. I'm looking at my time, and I'm a man under authority and time. So I want to call one of my senior colleagues here to give us a wrap, and then we'll take the picture and then we'll be out. Thank you. Aneeta, over to you. Aneeta Tang is one of the vice president at the World Academy of Productivity Science, and is my boss. Go ahead, please.
I hate Remy for calling us the senior colleague. Because you're disclosing my age. But anyway, I agree definitely with everyone on the importance of health, but at the same time, it is very important. Am I hearing echo? Anybody hearing any echo?
No, there is no
Okay.
echo.
Go ahead, please. We are good.
Okay. I definitely agree with the panelists on all the things they say about health, and particularly if AI is kicking in, we have more time for ourselves to do our primary food, and our mental health is excellent. So today's topic, the importance of health and wellness for global productivity, it's so relevant to everyone. Without good health and wellness, productivity will definitely be negatively impacted. Disregard the issue of technical difficulty that we have experienced is definitely a very good discussion to have. So on behalf of the World Academy of Productivity Science, I would like to thank the three speakers in making this very enjoyable and very productive and very insightful session possible. Harold, thank you. Aneeta, thank you. And SK, thank you very much. And of course, also big thank you for all those who participated in this particular session by taking out time from your very valuable time of the day, whether it's in the morning or afternoon or evening. We'll definitely email you the link for the recorded session. So if you believe that anyone in your contact that is interested in this particular topic and will get some benefit from reading or listening to the session, please do send them the link. Following through with today's discussion, the next topic for our discussion is mental health, which again is very important in my opinion, especially after the pandemic, that I at times feel that I'm mentally, well, negatively impacted in some sense. So I would love to hear what the next event, the specialist will tell us all about. And if anybody who is a special or an expert in mental health, please get connected with the team so that we can determine how we can put your expertise, to bring it to bear in our next event. So for now, it's a wrap. And the team is looking forward to seeing you again in our next event in a few months.
Thank you.
Stay tuned.
Aneeta. Yeah, before we go, we need to take a group photograph and smile. So that will be on our, so that will be the last wrap, right? Okay, so can everybody smile to the camera? Let me check. Let me check it and then be sure that we have it all. Good, all right. I think we're good. Thank you. Professor Bane, I'm sorry, we couldn't give you enough time to talk and share, but I think your observation is noted. I know that in the next meeting, we don't have something for the new fellows of the World Academy of Productivity Science. And then for other members that will be coming, I think there'll be induction time. Aneeta and Sonny can talk about that more. But we recognize those who are fellows here. And I don't know your name by head. I'll just be putting that down here. But I want to say thank you very much for coming. Adeniji, thank you. Ramat, thank you. Professor Bane, thank you. Professor or Dr. Bane, okay, I think it's the same person that's signing in two devices. Okay, Dr. Sano, thank you very much. SK, Aneeta, everybody. Special speakers. Thank you, Dr. Harald, Dr. Aneeta, and I think Aneeta has done that already. Thank you very much. It's been a wonderful time. I'm sorry about in and out. It's just technical issues. Those are part of the things we didn't plan for. But thank God for co-hosting that helped us to keep the productivity on. I would have been out and everybody would just shut out. But thank God for the AI that thought about that this could happen. And